Hello, everybody. Welcome to our webinar today. We have Lori Moore again with us, and she's going to speak about microdermabrasion, advanced techniques, and protocols. Lori is a licensed medical esthetician, as well as a licensed esthetician instructor. I had a little glitch. Did y'all catch all that about Lori? But anyway, so she'll be speaking for the majority of the time. And then as usual, we have Darla Smith. She's our general manager for Theraderm. She is the director of sales. She heads up all of our esthetician accounts as well as our UK account. So Darla brings to the table a lot of knowledge because she talks to skincare professionals on a daily basis in a real office, like real life setting. So she knows the problems and the issues and the things you guys are dealing with in your clinic when you're dealing with patients. So she brings a lot to the table with that. So that said, we'll just go ahead. I'll turn it over to Lori and she can get started with her webinar.
Hi, good morning everybody, or good afternoon. It's cold where I'm at. I've taken my jacket off and turned the heat on. So I know that you've taken time out of your day to come join us. I so appreciate you on this live educational webinar. I love, love, love training. I am a licensed master esthetician and a licensed instructor. So this is where I love to be. So thank you for joining us. If you're one of my students or you know me and you found out about this link through me, if you'll leave a comment, I'd love to know that you came today. But what we're going to be talking about this afternoon is microdermabrasion and how to advance microdermabrasion through a series of treatments. So microdermabrasion, like a lot of the other modalities that we do in our room, is a controlled wound. Micro meaning small, derm meaning skin, and abrasion is a scrape. So we're creating small wounds in the skin, micro tears in the skin, and using this procedure to stimulate growth of collagen and elastin in that dermal layer. So the benefits of microdermabrasion are the diminishing look of fine lines and wrinkles, hyperpigmentation, and stretch marks. So this kind of broadens our treatment possibilities from the face onto the tummy and the legs and the back. So we have a lot of options, and knowing how to use those options and what to use for those options as far as back bar product is very, very important. One of the things that I love about Theraderm isn't just their weekly webinars, but they also have a blog post, and their information that they give you is so up to date. This week, the blog post was about peptides, how they work, how they stimulate that collagen and elastin production, and what products they have that Theraderm carries that have these certain peptides in them. Great information to know when we're using them in our protocols on microderm, dermaplane, and chemical peels. So I encourage you to go look at that blog post. Darla, how often do you guys post to that blog?
I think she does pretty much like weekly or bi-weekly sometimes.
Well, and they always, so if you follow Theraderm on Instagram, they always post them on Instagram is where I see them. And they're always there. I haven't seen one be taken down, and I go and I refer to them frequently. So I really suggest that you do the same. So
yes, I was going to tell you, we are working on a professional site. Sorry to interrupt you, but that hopefully we will have coming in February, that we will have more of the blogs and information and all of the Zooms that we've done and more information. So we'll have marketing tools and things like that to be able to be used by everyone. So we are working on just a professional site that there'll be more information. It'll have our protocols and different things like that.
What a great resource. What an absolute great resource to have out there. So you guys take advantage of that. So microdermabrasion doesn't just diminish the fine lines of the look of fine lines and wrinkles. It cleans out the pores. It uses the suction. So if you've got somebody who's acneic, or if they're heavily sun damaged and they have impactions and clogged skin, dry, thick, clogged skin, it helps to do that. And it helps to brighten because we're taking that top layer off. It helps to brighten. So when we're talking about contraindications, the list of contraindications is pretty long. And when you're combining multiple modalities in your room, you need to know the contraindications for every modality that you're going to use. If you're combining dermaplaning and microderm and chemical peels, make sure that you are doing that client consultation card at every time they come to see you. And you are having them sign that stating that they have not changed their prescriptions and that nothing in their intake form is going to be contraindicating. So let's go through those real quick. An active infection of any kind, if they are on a prescription antibiotic, they are contraindicated for this procedure. If you have ASCP insurance, Associated Skin Care Professionals insurance, active acne breakout is contraindicated if you are not under a medical setting, if you are just a licensed esthetician working in a solo practice or working at a day spa. So know that, go to your insurance carrier and know what you can do and you can't do. Rosacea is going to be contraindicated. Any open wounds, sunburn, windburn, any irritated skin is going to be contraindicated. Use of retinols and retin-A are contraindicated. They thin the skin, they make them more sensitized. So that's out. Recent chemical peels. If they had a chemical peel yesterday or the day before at a different med spa and they come to you today wanting microdermabrasion, that is a no-go. They need to wait until their skin is in a healthier condition. So it's usually 10 days to 2 weeks after a chemical peel that we recommend microdermabrasion. Uncontrolled diabetes, diabetics who don't have it under control tend to bleed more and do not, they don't bleed more, they don't heal as quickly. If they are on aspirin or blood thinners, they tend to bleed more. So know that if you're combining dermaplaning and microderm, you're going to add an aspirin or a daily blood thinner to your list of contraindications. If they've gotten chemo or radiation in the past year, they are contraindicated as well. Accutane also within the last year, it thins the skin and it sensitizes the skin. So those clients, unfortunately, will have to wait. With microdermabrasion, since we're using suction, telangiectasia is contraindicated. Now, if they have telangiectasia, I have it on my cheek. I dermaplane and microderm my forehead and my cheeks where I don't have those tiny little blood vessels. But if you've got somebody who has telangiectasia, they typically have it around their nose, on their cheeks. If they have widespread telangiectasia, I don't do them. Typically, they're going to be more prone to pulling those blood vessels. Remember, we're using suction, pulling those blood vessels and bursting them, and that's not what we want to end up with. We want to end up with healthy, gorgeous, glowing skin. So telangiectasia is out always. We do not microderm over warts or moles. And injectables in the last 2 weeks, as we're suctioning and moving the skin around, I don't want to move the injectables that you paid a lot of money for and have you walking out looking all wonky. So at least 2 weeks post injectables. One of the things that's really trendy right now that I love is the microblading of the eyebrows. If they've recently had microblading, you don't want to go near those brows with microderm, and you don't want to go near those brows with chemical peels. So know that as well. We want to be extra careful with those procedures that we're all loving to see right now that are very popular. Post-waxing services, about 3 days. Let the skin re-epithelialize if you're using soft wax, which lifts skin cells. If they're using hard wax, you may be able to, if there was no irritation, do it sooner than that. But usually waxing is 3 days. Now, laser treatments, that again is there under the care of a physician. I always like to have my clients wait at least a month after a laser treatment. That's a very invasive procedure, and usually their physician isn't going to release them that quickly anyway. So make sure that you know those contraindications before you start. So the third slide is going to be combining services. I love to combine microdermabrasion. We talked last week in the webinar about dermaplaning and combining that. Microdermabrasion is one of the things that if you have somebody just asked, I saw it come up, pregnancy is a contraindication. On my ASCP client intake form, pregnancy is listed as a contraindication. Check with your insurance company. Double check me. I could have read it wrong, but I have ASCP, Associated Skincare Professionals insurance, and on my intake form, it is contraindicated. So, and I looked at that while I was making these slides, so I didn't really do that from memory. I did go and double check what their contraindications for this procedure were. So, when we are combining services, I love, love, love to combine dermaplaning, microderm, and a lactic acid peel. Knowing what you are treating and knowing why you are treating and what you're using it to treating with are going to be very, very important. So usually when I use dermaplane, microderm, and lactic acid, I am trying to treat mature skin, sun-damaged skin, skin that has lost elasticity, skin that is hyperpigmented, skin that has fine lines, maybe a little bit deeper of a wrinkle. Now, we are taking off the top layer of the skin, and we are using multiple mechanical forms of exfoliation and a chemical form of exfoliation. So it is so very, very important that you pre-treat your higher fits types, your 4s, 5s, and 6s. We do not want to hyperpigment them. And when we talk about pre-treating, I'm not just talking about using a lightener, brightener, melanin suppressant, tyrosinase inhibitor. I'm also talking about hydrating that skin. I want you coming in, I want my clients coming in with the healthiest skin possible. I want them on a cleanser that isn't stripping their skin and compromising their barrier. I want them on a toner that is hydrating and really nourishing their skin. I want them on a moisturizer that is building and that is going into the skin and isn't just sitting on top. And the one thing I really, really want is a client who's compliant with their sunscreen. SPF is their BFF. For 3 days to 7 to 10 days after this treatment, they are way more susceptible to UV sun damage. And since that's part of what we're trying to combat and trying to treat during this treatment, we certainly don't want to make things worse. So selling your clients a great micronized zinc, which is what Theraderm uses, is great. A physical barrier so that they can't get that sun damage. If you stop it at the very beginning and it can't trigger the melanocyte to make melanin, then it's a win-win. And your higher fits, 4, 5s, and 6, we use this all the time in my treatment room. It's my hands down favorite sunscreen because it is so micronized that your higher fits don't leave with that white sheen. They have that beautiful skin tone that we all love to see after our treatment. So know that you're looking for a really great micronized zinc. It's also a great anti-inflammatory. I don't care if I do this procedure last thing at night. If you leave my treatment room at 8 o'clock at night, you leave with a sunscreen on.
Hey, Lori, I have a question. You know,
Yes.
you were talking about dermaplaning and then microderm and then chemical peel.
Right?
I had a lady, and I think I told you that she did the dermaplaning, and then of course she put the lactic peel on, and she dermaplaned dry. And of course the customer was burning.
Ouch.
And red. So, you know, it's very important that, you know, it's like kind of give them the road rash before then they do the microdermabrasion. I guess my question is on the microdermabrasion, is there certain settings that they should do before, if you're going to do a peel versus just doing the microdermabrasion? Because I know of the suction, and if the suction's too much, you can break capillaries. Is there certain guidelines of how rough they should be, or?
So here's the Lori Moore philosophy on this, because I love to combine all three. So let's talk a little bit. We talked last week about dermaplaning, and you're talking about dermaplaning dry. When we dermaplane somebody dry, we're creating friction. Friction creates heat. Heat stimulates the sebaceous glands, and it stimulates the melanocytes. So I love Dermaplane Pro. because they use an oil to dermaplane with. So I'm creating less friction, less heat, less inflammation as I'm taking the top layer of skin and all of that vellus hair off. If I'm going to combine dermaplaning with microderm, I turn my suction down on the microderm. And if you read the latest research on microdermabrasion, what I have read is that lower suction and more passes actually gives you a better result. The more aggressive treatment of higher suction and really getting in there is creating more inflammation and an inflammatory response that we're not wanting, instead of triggering the production of collagen and elastin. So every time that we can tamp down that inflammatory response some, and put in the powerhouse ingredients. We talked last week about, if you don't want to use oil when you dermaplane, to use OPC serum and work in quadrants. And we're already putting those healing ingredients, whether it's OPC with the hyaluronic acid, or if it's the Dermaplane Pro oil that's got all of the nutrients and the antioxidants and all of that. If we're hydrating and we are putting those anti-inflammatories and those vitamins in as we go, you're going to stand less of a chance of getting road rash.
And I had a person ask, do you microderm first or dermaplane, or does it matter which order you go in? Or
okay, so personal preference, I dermaplane first. If you think about it, and I'm taking that surgical scalpel over your face, I'm not going to get every skin cell, but the blade is going to pull the skin cells, some of the skin cells up, and microdermabrasion over the top of that is going to go ahead and kind of peel some of that off. Also, on the microdermabrasion, when we create those micro tears, if I'm creating micro tears in that dull, thick top layer of skin, I'm not going to get as great of an immune response as I do if I've taken a lot of that off and do it on fresh skin, on the skin that's underneath, that's newer, and that isn't as dehydrated and isn't as old. So I dermaplane first. Then I microderm. I turn my pressure down on my microderm, my suction down, and you're never supposed to push the apparatus down. The machine will do all of the work for you with the correct suction. So my machine is a typical machine out there. I don't use crystals, I use diamond tip, and I set my machine at 10 when I'm doing it after dermaplaning. When I'm doing it all by itself, it's usually between 12 and 14. So talk to the manufacturer of your company, what's their general setting. If I'm combining multiple mechanical exfoliating procedures, I'm doing everything. I'm not gonna do as many passes with my dermaplane, I'm not gonna be as aggressive, and I'm not gonna be as aggressive with microderm. Lactic acid is so hydrating. It gives an absolute beautiful finish to this procedure. But again, I'm doing this for somebody with dull dehydrated skin. We're wanting to combat a little bit of hyperpigmentation. We're wanting to combat fine lines. And this is not really, it works well with acne because we tend to dry out our acne, and then we have dull, dry, dehydrated skin. But a Jessner's peel works really great for acne. So know, who is it that you're trying to treat? What are you trying to treat? What skin condition? What Fitzpatrick type are they? Everybody's going to benefit from pre-treatment, but with your higher fits, you're going to want to not just add those hydrating, nutrient-dense, nutrient-rich ingredients in your home care, you're also going to want to add that melanin suppressant. So the difference in Dermaplane Pro and dermaplaning dry, real quickly, isn't just the oil that we use. We also go above that orbital bone, which in your foundations class for dermaplaning, most people do not teach that. It's thinner skin. There's a rationale behind why we do it. There is a technique to doing it to keep your client safe and protected. We go up and over the nose. There is a way to do that to keep your client safe. I did see somebody, and I just cringed. They took that blade right to the tip of the nose and they were coming up. If you want to cut somebody's nose off, that's between you and your insurance company. For me, I want to keep my client safe. I am a certified trainer for Dermaplane Pro, and we have a way of going up and over the nose in that nasal labial fold so that you get great exfoliation while keeping your client safe. I also train my students to go right up and over that vermilion border. If you are using your Woods lamp and your client has dull, dehydrated white skin on their lips, dermaplaning right over that vermilion border is a great treatment. I love it, love it, love it. Every one of my mature clients or dry clients absolutely love it. So I really suggest that you find a certified trainer in your area if that's something that you're looking into. It absolutely will set you apart from your competition. So the next slide, they were asking, some people were asking, which way do we go? What do I do? So I've got a slide that has advanced protocols on it. That one's the Jesners. Can we go back to lactic? There we go. So you typically, and this is just mine, typically when I have a first-time client come in, absolutely, I will microderm them if they are not contraindicated. I love a great enzyme peel, and new peel from Theraderm is my favorite. It's so very versatile. I new peel them and I microderm them. Then I love to use ultrasound to push hydrating ingredients down in there. It's a great relaxing service, and LED light treatment afterwards if they are red or irritated. The second treatment, they'll come in, I will new peel them, dermaplane them, microderm them, and new peel them again with steam. So I'm adding more exfoliation each time they come in. I'm adding a little bit more exfoliation and gauging how their skin reacts to that. The third time they come in, I'm new peeling or enzyme peeling, dermaplaning using a lactic acid. I am repeating those steps every 7 to 10 days for a series of 5 to 7. And we've got that listed out. It's so tiny that I can't read that. Sorry, guys. But you're going to repeat those treatments. It's in your Theraderm product knowledge book. Dr. Beckman lays out his protocol. My protocol is a little different. I don't work underneath a physician. So my first 2 treatments may be a little bit different than your treatments if you work under a medical supervisor. You may jump right into dermaplaning, microderming, and chemical peels. Know that you can do these treatments every 7 to 10 days. I am not going to dermaplane and microderm every time you come in for those treatments every 7 to 10 days apart. You don't need to dermaplane somebody's face every 7 to 10 days. The hair isn't growing back, and we don't want to thin the skin so much that we're creating more of a problem. The goal is to build healthier skin, not to thin their skin so very much that we've created a problem. After the 8th treatment for me, so it's 5 to 7 chemical peels and a time or 2 to begin with, you're wanting client retention. That's what we're all about, having that client come in to see us monthly for an exfoliation treatment, a more aggressive exfoliation treatment than what they can do at home, and making sure that they are compliant with their home care. You're not going to have a client spend a whole lot of money on a series of microderm and chemical peels and dermaplaning and then not be compliant. Those are your clients who love our home care, love our knowledge, and they're coming back and they're scheduling monthly. So if you are combining services for an acneic client or an oily client, then we switch over to dermaplaning, microderm, and a great Jesner's peel. So lactic acids tend to work between the cells, and salicylic acid works down in the sebaceous gland. It helps to take apart the skin cells that are stuck together that are clogging that pore, and it helps to suppress oil production. So if I've got a client who is acneic, I love to go to the Jesner's peels. It produces, so your Jesner's peel is different than your lactic peel. You're not going to peel with a lactic peel. Most of your clients are never, that's not the intention of a lactic peel. They're not going to peel. Your Jesner's peel is where you're going to get that skin peeling that some of your clients love. They want all their skin to come off. And a Jesner's peel is going to be where you get that. I don't peel with a Jesner's peel. Darla, you don't peel with Jesner's peels, do you?
No, I don't peel it. The only time I peel is if I do a TCA.
Right. So know that your client may not peel, but most clients generally peel with a Jesner's peel. Jesner's peels,
Lori, can I ask a question real quick before we go on to Jess? One of the ladies is wanting to know, do you personally add a mask after your lactic, or, and it says after lactic and then massage?
So no. I am not going to stimulate the skin anymore with a massage. And I don't add a mask because lactic requires neutralization. And you want to make sure that that face is neutralized. If you didn't neutralize part of where that peel is and you put a mask on, that kind of worries me. So after my peel, I am going to put on, and it's in the protocol from Dr. Beckman, after my peel, I put on the OPC serum, I put on the Eternox peptide cream and the sunscreen, and they leave my room. Once I have done my peel, my service is over. If you're going to do a massage, I recommend that you do it pre-peel. I'm not wanting to overstimulate that brand new skin that's just had acid poured on it. So no, that all comes before if you're going to do that. And was there a second part of that question, or did I hit all the highlights on that one?
Basically, it was, do you use a mask or a massage?
So I use a mask on a Jessner's.
Okay.
So Jessner's do not need to be neutralized. They are self-neutralizing, and I love using Jessner's with a mask. Rumor has it that Theraderm might be working on a mask, and I have my fingers crossed for that. The mask that I personally use is from Estemax, and I love that as far as an after treatment. It is not part of Dr. Beckman's protocol, so forgive me, Dr. Beckman. But my clients do love a mask after my Jessner's peel. I do it to myself all of the time, and it is very, if you are reactive and you are red, it is very calming and very soothing. So that's the difference. Lactic acid requires neutralization, so I don't put anything over it to make sure that if I didn't neutralize every single spot, that I am not pushing that peel down further and going outside the scope of my license. But Jessner's peels, absolutely, you can do a peel over that. And the difference with Jessner's is I use it with my acneic clients. You can also use it with mature clients, so it's a very versatile peel. It also treats fine lines, hyperpigmentation. It even goes to those medium depth lines, which I love because I have some lines, Darla. When you are advancing that protocol, I love using new peel. I love using new peel with steam. These are a series 1 to 2 weeks apart, so we're kind of spreading these out a little bit further. And it's a series of 4 to 6, so we're not doing quite as many. We're lactics 5 to 7. I always follow the Theraderm protocols except for the mask. And that's where I kind of deviate a little bit. And after my 8th treatment, I am back in on that regular monthly maintenance. So the last slide is marketing your Microderm. And I love to market Microderm for post-pregnancy pampering. I was one big stretch mark after pregnancy. This is not going to eliminate stretch marks by any means, but it can absolutely grow better collagen and elastin, newer, more flexible collagen and elastin, so that skin doesn't look quite so angry. I would wait if she is freshly post-pregnant and those stretch marks are irritated, you might want to wait a little bit, give that time, skin time. Put her on that home care. That OPC all over that belly is going to feel fabulous and going to help treat that inflammation, help hydrate her, and help get her ready for Microderm. Back facials for men are where I love to use that Jessner's peel. Know that this is where you can recommend waxing to your clients. So you're going to get both your waxing client and your back facial. You want to take that hair off. Suctioning hair is never fun. But a lot of women also who work out, especially tennis players, golfers, sweat a lot, can get some back acne. This is a great treatment for them. I find that I do a lot of autumn in September, October advertising to get rid of some of the sun damage that they got in the summer, that hyperpigmentation. This is a great time to market that. Make sure that you're branding your business so that every time you're talking to your client, client. They see the same thing over and over again. And make sure that you set yourself apart. Get that extra certification. Take that class. Become an expert in what it is that you do and specialize in that. You can always ask your clients to send you reviews on Google and Yelp. That always helps. And post those reviews to your website. So that's my part of the presentation. If you guys, if there are questions I haven't answered, or if there's something Darla or Christina wants to add, that would be awesome.
I think we've answered most of the questions. I was going to kind of look here, because we talked about microderm first or dermaplaning, and you answered that about the pregnancy. Let's see if, okay. Kind of a question that, you know, I have, I think a lot of people, it kind of worries me sometimes when I talk to some estheticians, and it's more about making sure that you are getting trained by a licensed trainer. I know that it's came up several times that just because a person does dermaplaning doesn't necessarily mean that they can train you and certify you. Can you kind of talk about a little bit about that, Lori? Because I know that you are a trainer for DermaPro, but I know that there is a lot of people out there that actually aren't trainers. I mean, like, I can classify myself as a trainer for Theraderm products, but that doesn't mean that I can certify you on dermaplaning or microdermabrasion. And I think people are kind of getting misled on certifications, and that, you know, they need to be really, what do they look for to make sure that they are getting certified by an actual trainer?
So you want to make sure that whoever you're being certified by is with a reputable company. Dermaplane Pro, we distribute worldwide and we train worldwide. Theraderm's worldwide. So you're looking for that reputable company, but you're also looking for credentials. You are looking for certified through that specific company for dermaplaning, but I am also a licensed aesthetics instructor. It was 2 years of my life, a lot of money, 1,800 hours, and 2 board certifications. So anybody can say, I can train you to dermaplane, or I can train you to microderm. It comes down to your state board and what they will allow and what they will not allow. You need to check with your state board. I believe that in most states that you cannot pick up a scalpel and train somebody to use that scalpel in dermaplaning unless you are a licensed instructor. Again, that's a state board question, but even if in your state they will allow somebody to train who is not a licensed instructor, I would encourage you to find that licensed instructor. Most schools will train you and will certify you. Just because somebody's been in the industry a long time doesn't mean they're up with the latest technology, that they followed the science, that they understand the rationale behind what they are doing. They could have learned it incorrectly and be passing on that incorrect information. So really doing your research, who is this person that you're asking to train you, is very, very important.
Okay.
And it'll keep you and your clients safe and protected.
Right. I think that is sometimes where I know that we want to get as much knowledge and training, but you know, sometimes if we go to people that aren't qualified, then we are trained incorrectly, and it just can cause some problems down the road, because you can have a client come in and, you know, it's like dermaplaning with, you know, open acne, and, you know, causing more issues for the customer. So you did mention you love masks, and yes, we are working on 2 masks right now. We are working on an anti-aging one, and more on like acne masks. So yes, that is in the works, and we are actually kind of testing a couple from our manufacturer right now. So hopefully those will be coming out soon. And the other thing is we we've kind of done Zooms on products, and then Lori stepped in and helped us do some on devices and, you know, the protocols. If anybody has any suggestions on what they would like, what, you know, we would love to hear from you, because we're trying to do them weekly, but we want to make sure that it's something that helps you in your business, that it's practices that you do, or if we can help you on even finding instructors and things like that, to marketing. I think that is a big thing. It's like, once you get the customer in, and Lori, you can jump in on this, I know that we get so wrapped up in the procedures that we're doing and trying to give them the best treatment while they're on the table, but we forget about sending them home with products to take care of their skin after, you know, for the aftercare. And I know that a lot of times people don't like to sell, but that's part of your business. That's part of them coming back, because you don't want them going to Walmart and getting something off the shelf after you've just spent an hour trying to get their skin back in line. So I think marketing and doing your sales to them, you can talk about their products while you're going, and do you like the feel of this? And then afterwards you can say, you know, I have some of those products that I used on your face, and it'd be great for you to use them at home.
So I had a client this weekend. She was a Dermaplane Pro student. She had had microneedling done, and she used Neutrogena for her aftercare. And it's one of those things. The whole point of microneedling is to build that new collagen and elastin to erase those deeper lines. And she was using a product that didn't necessarily have anything in it that was going to do that. It was more just a moisturizer than it was something that had those powerhouse great ingredients that are building that bottom dermal layer of skin and making you look more youthful. So don't be afraid to offer the client something that is going to enhance your service. They came to us because they want the best treatment possible for whatever condition we're treating them for. So it's funny to me that we would let a client walk out and walk to Walmart and get Neutrogena products when I have products that are Theraderm's products are so competitively priced in the marketplace. They're not that much than if they walk up to the Estee Lauder counter or the Clinique counter. And I know that those products work. They were formulated by a board-certified plastics reconstructive surgeon who worked with burn patients. So we're creating a wound, and he specialized in healing wounds. So if you're talking to your client in those kind of terms, they want what you have to sell. They don't just want your treatment. They want your home care products. And explaining to them what the importance of home care and how they're going to help them not have to come back to you long-term to fight this one problem, or possibly not end up in a plastic surgeon's office for an invasive procedure. It's a win-win for both of you. So I highly encourage you, read those ingredients, go to the Theraderm's blog, learn all you can about those powerhouse ingredients, and start talking to your customers about what they do to improve their skin.
I did have a question on what kind of mineral makeup do you suggest use?
So Dr. Beckman does recommend a mineral makeup after his Jessner's peel. I tend to skip the mineral makeup. I wear very little makeup. I have a tinted sunscreen. And I use a little bit of tinted sunscreen to cover up my dark circles under my eyes, and I use Theraderm sunscreen, and that's the only foundational thing that I have. So I'm not a great mineral makeup girl to ask about that, but I do know in his protocol, it is in the book, he recommends a mineral makeup for those.
And we do suggest, it's more not after Jessner's, but more when we do a TCA.
There you go.
And he recommends that after a TCA, when you start peeling and you look, I mean, you know, as a TCA, it's a really deep peel where you're peeling that first layer of skin off. So you're looking pretty like a monster. I mean, like I've got pictures. I mean, I did mine over Halloween and I could pass for a mask. So the Jane Iredale, the loose powder does not sting that new skin. And it kind of helps blend in where you don't look as bad. but I don't necessarily, after doing a Jesner's, and Lori, you might be the same way, I don't really like people putting makeup back on because we've just opened up their pores and trying to clear things up. And I don't like, you know, maybe the next day, but I don't really like putting products on. I really don't like them. I mean, leave your eye makeup on if you want to do that, but I really don't suggest putting product on unless after several days, if you've done an in-depth peel.
Right, I don't. If we're doing an in-depth peel, if you can go 3 days without makeup, if you can schedule it over the weekend or whatever, I recommend that you leave that skin just like it is. I recommend that you cleanse it and that you moisturize it for those first 3 days. I follow Dr. Beckman's protocols, and I'm not a big mineral makeup advocate as far as my clients are concerned. If they have to have one, Jane Ardell's a good one. Any esthetician can, but Jane Ardell's at most of the shows. Right. So you can go and you can sell that. It's a great, you know, double benefit for you. You can sell that in your salon. So I know that he does recommend it, but for me, I'm a little older, and any type of makeup that I put on my face, I want people to see my great skin, not my great makeup.
Right, so, and that's the way with me. I'm 58 and I wear no makeup. I mean, the only time that I might put some mineral makeup on is when I do the TCA, but every day I wear no makeup at all. I mean,
okay. So I had scissors that I was cutting sheets of skin off of my face after the TCA peel. So yes, I definitely understand how aggressive that peel is. I don't know, my skin was so sensitized after that peel though, I don't know that I would have wanted a makeup on. But if somebody has to have it, Dr. Beckman does recommend that you use one.
Right. I think we've got everything answered, and so I think our time is up for the day. If anybody has any questions, feel free to email us, call, and we will get those questions answered for you. So everybody have a great week.
Thank you.
Thanks. See you later.